Since the beginning of this pandemic, Wayne County has recorded nearly 45,000 infections, and that number includes the city of Detroit. Oakland and Macomb counties are both still considered hotspots. And right now, we want to bring in someone who can help us kind of sort all of this out. We are joined by Chief Health Editor, Dr. PARTHA Nandi. Dr. Nandi, thank you so much for joining us this morning. Obviously, we're seeing other states and cities taking drastic measures. Chicago, we just reported, shutting down for 30 days, and states closing bars and restaurants earlier. Do you think it'll be necessary to do some of that here in Michigan?
I certainly hope not. And here's the thing, and we've been saying this again and again. You know, what's happening now is what happened 3 weeks ago. If we take this seriously now, we can prevent more drastic measures down the road, right? We got Thanksgiving coming up, so you know it's a big challenge. But I'm hoping we don't have to. But again, the safety of our citizens come first.
For sure. And if someone out there is watching this and they start feeling ill, they get tested, and then they are diagnosed with COVID-19, you start to show symptoms, obviously, but you don't want to expose others or bog down hospitals right now, and they're feeling the strain. How do you know when it is time, though, to head to the hospital?
100%. As soon as you're COVID positive, make sure you contact your doctor, your healthcare professional to know what to do first of all. So you got to know what the signs are. But your question, what happens when you're positive and even if you're quarantining, the moment you're having shortness of breath, you got to go. You got to go and get checked out, because what happens with this disease is that your oxygen saturation may be much lower than you think. So any shortness of breath, if you have any chest discomfort or pressure, go right away. And if you're with someone, let's say your loved one has COVID, if you see their face or their lips starting a little blue, get them to the hospital. If you notice that they can't stay awake or they're having trouble staying awake, get them to the hospital. If there's any signs of confusion, that they're not quite what you thought they should be, then take them to the hospital. Even though we want to keep our hospitals, right, not burdened, but this disease can affect you in so many ways. If you have any doubts, get over there. And if you're doing okay, they can send you home. But those signs, like I talked about, would definitely be reasons for you to get to the hospital right away.
You know, we still have the images of the TCF Center, transformed into a field hospital. Do you anticipate more of those kind of scenes?
Again, I hope not. But here's the thing, right? We got Thanksgiving coming up. And if anybody is on the fence saying, I don't know what to do, this is what I'm going to do with my family. I'm going to have Thanksgiving with my immediate family, where I know what we're all doing. I know what we're social distancing and masking and disinfecting. So what I would recommend everybody, if you can, this year, don't make a big Thanksgiving gathering. Here's where the virus
can
spread, right? In these gatherings.
Dr. PARTHA Nandi, thank you so very much for joining us this morning, because a lot of people are concerned about this. We do appreciate it.
My pleasure.